last summer I tried to help you use it.
That's pretty good.
Okay. Good morning. I'd like to welcome you here to a press conference organized by the Canadian Health Coalition. And it's my pleasure to introduce our two speakers this morning. We have a distinguished professor of economics, University of British Columbia, Dr. Robert Evans, Order of Canada, graduated from Harvard in economics, and one of the leading health economists studying comparative healthcare systems and funding strategies for healthcare, and has a lot to say about the facts and the myths around sustainability of Medicare. And we're also pleased to have with us Nik Nanos of Nanos Research, a well-known pollster in Canada. So over to
Great, thank you very much. I want to quickly walk through some numbers in regards to healthcare and perceptions of public healthcare specifically. What's actually quite interesting is that, when you look at the last decade, healthcare has quite dominated what I'll say the mindset of Canadians in terms of top national issue of concern. And on any given day, it's been either first or second. But what's interesting is that now what we've seen is that the economy has dominated what I'll say the mindset with concern about the economic recession. But with that, as the economy is perceived to be stabilizing, what we see is a return to healthcare as the top national issue of concern in the last two waves of Nanos Research. And it's really not surprising because we all know that when we ask Canadians what's important to them, it's usually issues that what I'll say practically touch their day-to-day lives. So it's not surprising that if you're living in rural Canada, you're probably concerned about whether you have a doctor. If you're probably worried about whether your mother or father can get access to a medical procedure. So it's not really surprising that healthcare is starting to kind of what I'll say regain momentum as a key issue of concern among Canadians. Now, we decided to test on perceptions related to public solutions for public healthcare. And the key takeaway is that this is a political slam dunk. Almost 9 out of every 10 Canadians, 87.3, support or somewhat support public solutions to public health care. And I think this speaks to what I'll say a firm, ingrained view in regards to a path that Canadians would like to see in terms of moving forward on healthcare solutions. Now, what we've noticed in our tracking on this particular question is that support, this overwhelming support, has been fairly consistent over the last year. But there have been some minor regional variations where, interestingly, support has actually increased to over 90% in the province of Ontario. And the intensity of support has diminished, but is still very strong in the province of Quebec. Now, we also asked Canadians about where they thought costs were being driven, or how they were being driven. And we provided Canadians with two general options in regards to where they thought the expenses were increasing in terms of health care. One option was what I'll say public health care, such as hospitals and doctors. And the other option had to do with those healthcare services which are partially or not covered by public insurance, like dentistry, eye care, prescriptions, and physiotherapy. And interestingly, it was quite a mixed bag. About 1 out of every 5 Canadians were unsure where the costs were being driven. 43% thought that costs were being driven by hospitals and doctors, and 34% of Canadians thought that costs were being driven by those things that are not covered by public insurance. So when we ask Canadians the big question on, where costs are being driven and where they're coming from, quite a mixed bag. And I think this points to an opportunity to educate and engage Canadians, not just on those public solutions that they want, but understanding where the costs are being driven and how the system can be made sustainable, a public system, in the long run. Thank you.
Thanks very much, Nick. I think that's the key question that Nick left us with. The question of how you maintain the sustainability of the system into the long run. And I think there are answers. And the kinds of framing that's being put around it at the moment, I think, is highly deceptive. The notion that there are inevitable expansions in cost which will simply make it impossible to sustain a public healthcare system. I think this is profoundly in error, and I think the error is, a large extent, deliberate, and driven by underlying conflicts of interest in the system. So we're being told that the aging of the population and the ever expanding demands for health care will simply go beyond the fiscal capacity of our governments. These are not new arguments. These arguments have been around for a long time, and their underlying motivations, I think, need to be brought out into the open. But first, I think some sort of general background on past and future. The general background is that every dollar of expenditure on healthcare is a dollar of somebody's income. Absolutely, necessarily, always. So that when you start talking about healthcare costs and trends in healthcare costs, you are simultaneously talking about trends in incomes. And if you think about policies to try to limit their growth, then you are attacking some incomes or somebody's income aspirations. So there's nowhere around that. And associated with that, it's been known for a generation that in every healthcare system in the modern world, there is a constant drive for more money. And the only way you can contain that is by limiting the supply of money. That various other mechanisms, such as trying to improve the health of the population through better preventive measures, etc., are good in themselves, excellent in themselves if they work, but they do not speak to the question of cost escalation. The two things are simply not connected. Efforts to try to moderate demand by user charges. Those ideas have been around for years. They've never worked because, again, they do not speak to the underlying question of the internal dynamics of the healthcare sector. It's like, to be rude, you could think of it as a vascularized neoplasm that just absorbs everything it can get near. So cost containment, cost moderation, expenditure policy will come down to limiting supply of money and running head-on into the interests of the people whose incomes are going to be limited. Now, Canada has actually done reasonably well over the years in containing costs, particularly within them, so that when we are told that the public system is simply gobbling up an ever larger share of our resources and this cannot be allowed to continue and so on, that's not actually consistent with the data that are put out by Finance Canada and by the Canadian Institute for Health Information. What they show is a slowly growing, relatively stable share of national income going to Medicare, the hospitals and the doctors, a more rapidly expanding share going to healthcare in general, because that's where you're dealing with things like pharmaceuticals and programs that are not under public control, that in general sole source public financing, as in Medicare, tends to mitigate, to limit the rate of escalation of costs. And that's, this is pretty straightforward, the number in the public domain from Finance Canada and from CIHI, and it's not terribly difficult to put the charts together and show that. One of the things, however, that's been used